Okay, right, we're going to cover a few things in this brief lecture. We're going to cover bits of the brainstem. So we're not going to do the external anatomy. I believe there's already some earlier lectures a few years ago on those. So we're going to cover the brainstem sensory and motor cranial nerve nuclei, where they are and what they do. So their anatomy and their physiology in the most rudimentary sense. Okay, we'll also cover the blood supply to the brainstem. So very important. So this is quite a lot of things. It's often hated, but it's actually not that difficult. So I'm going to draw 4 circles first of all. And the first circle is the midbrain. The second is the pons. And the third is the upper medulla. And then we have the lower medulla. Now I'm just going to segment these roughly into 3 distinct bits, sort of an anteromedial, anterolateral, and then a posterior region. Now our midbrain is quite straightforward. So our midbrain is our superior cerebellar artery, posteriorly, and then the rest of it is PCA. Okay? The pons is the basilar artery with its pontine branches coming off. So that's dead easy. So they're not too difficult, are they? Now, our upper medulla and our lower medulla is the anterior spinal artery, the anterior spinal artery, the vertebral, the vertebral, the vertebral, the vertebral. So its anterior portion and its anterolateral portion is the same. But in the lower medulla, it's posterior spinal artery, but the posterior spinal artery doesn't emerge to the upper medulla, so this uses pica. Posterior, inferior, cerebellar artery. So, I suppose we can summarise the midbrain, superior cerebellar and posterior and PCA. Pons is the basilar, then we have the pica, the vertebral and the anterior spinal, the vertebral and the posterior spinal. Now, that's the blood supply. Where that's coming from is the vertebro-basilar system. So we've got our 2 vertebral arteries which conjoin to form the basilar, giving off various pontine arteries. It terminates ultimately as... I'll draw that a bit better, shall I? It terminates as the PCA, which enters the circle of Willis, right? Just before it does, it gives off the superior cerebellar artery, and the basilar itself, other than giving off those variable pontine branches, it also gives off the anterior inferior cerebellar artery. Posterior inferior cerebellar artery usually comes off the vertebral, though not always. Obviously this is highly variable, but this is the generic textbook that you would basically be tested on for most things, generally. So you've got the midline singular anterior spinal artery. So in terms of what we've mentioned you, we've mentioned you, we've mentioned you, we've mentioned you, and we've mentioned you as a blood supply to the brainstem. The midbrain is SCA and PCA. Pons is basilar. The upper medulla oblongata is anterior spinal and vertebral, as well as vertebral. As well as pica, and the lower medulla oblongata is anterior spinal, vertebral, and what else? Posterior spinal. So, we now come to the brainstem. Now, the sensory nuclei of the brainstem are quite straightforward. You've got fifth, which is divided 3 ways. Mesencephalic, chief, principal or pontine as it's called, and the spinal. You've got the 8th, which is purely sensory, and then you've got the nucleus solitarius, right? The solitary nucleus, which has 3 functions: gustation, which is 7th and 9th nerve, respiratory regulation, and laryngopharynx sensation. right? Motor is a whole list. So motor is 3, and the Edinger-Westphal nucleus, which is the parasympathetic nucleus involved in meiosis. 4, 5, all the motor ones. 6, bear in mind that obviously associated with a lot of these will be the medial longitudinal fasciculus. We have 7th motor, and then we have 7th parasympathetic, which is the superior salivatory nerve. We then have 9, and its parasympathetic, which is the inferior salivatory nerve. We then have 3 broad columns that span most of the medulla. The nucleus ambiguus, which is the largest of the 3. Then the dorsal motor nucleus of cranial nerve 10. And finally, hypoglossal, the 12th nerve's motor nucleus. Often this is drawn, right? So it's drawn in a stepwise manner, like so. I'm going to draw the sensory on this side, and I'm going to draw the motor on this side. So the sensory fibres, big chief with a mesencephalic coming up to the pons, and a spinal going to the medulla. The mesencephalic is proprioception of the face. The chief is touch of the face. And the spinal is pain and temp. Nociception and thermoreception. And that's obviously all 5th nerve. Right? The big trigeminal nuclear complex of the brainstem, spanning all 3 layers. We then have, at the pontomedullary junction, so spanning both, a sort of pacifier-looking structure, which is 8th. And then down here in the medulla, on its own, hence its name, is that solitary nucleus. The solitary nucleus with the function of girl. Gustation, which is 7 and 9. Respiratory regulation, and laryngopharynx. That's sensory input. Okay? Now, how about the motor input? So the motor input, so we have 3, of which the medial most one is the Edinger-Westphal, or the accessory ocular motor nucleus. Below it is 4. Both of these are in the medulla. 5 is away from the midline. 6 is in the midline. 7 is away from the midline. The second 7 is at the pontomedullary junction. That's our superior salivatory nucleus. 9, inferior salivatory nucleus. Then we have 3 columns. So we have the 3 columns, A, B, and C. Now A, B, and C. I'll just code it like that, shall I? So, A is the nucleus ambiguus. B is the dorsal motor nucleus of 10, and C is hypoglossal, the 12th nucleus. Now, the nucleus ambiguus is the motor nucleus of 9th nerve and 10th nerve. So let's do a quick summary. So we've got 5th nerve, which is proprioception, then touch, then pain and temperature. The way I do it is sort of like a descending scale of sensation. So proprioception, it's hands off. Touch, it's light epicritic touch, and then pain and temperature. So it's like a hand coming towards the face. So proprioception, it's not there, it's your position in space, right? Touch is epicritic touch, and then pain and temperature. And that makes sense, because we know that the 5th nerve subserves as the equivalent for the head as the dorsal column and the anterolateral funicular functions, right? So we know that the dorsal column medial lemniscus is epicritic touch and kinesthetic sense, which is these 2, and we know that the spinothalamic tract, pain and temperature, right? Then we've got 8th nerve, which is obviously vestibular and cochlear sensations. It's divided several ways, but that's not the remit of medical school. And then we've got the nucleus solitaris, which is gustation from 7 and 9, respiratory rate from 10, and laryngopharynx, which is from 9 and 10 normally. Obviously these stretches are both bilateral, but I've drawn all the sensory on one side and all the motor on one side, just so you can compartmentalise. Now your ending of S file has 3, so that's your meiosis, pupillary constriction. 4, both in the medulla, in the pons, you've got 5 there. And then 6 and 7 here. 6 should be a little bit lower down, but obviously this isn't to scale, because we know that 6, 7 and 8 come from the pontomedullary junction, and then 9, 10, 11 come from the junction between the olive and the inferior cerebellar peduncle, and 12 emerges anteriorly from the junction between the pyramids and the olives, right? So, superior salivatory nucleus and inferior salivatory nucleus. So let's just say a quick point about these. So our superior salivatory nucleus is the parasympathetic region, the parasympathetic nuclei of cranial nerve 7. And its function is salivation of the submandibular, the sublingual, and the lacrimal gland. The inferior salivatory nuclei is ninth nerve. So the ninth nerve's function is parotid. Whoa! Did not mean to do that, it's parotid. And then we've got these 3 tracts, A, B, and C. The nucleus ambiguous, dorsal major nuclei of 10, and cranial nerve 12. So you could often be asked, what is the difference between the nucleus solitarius and the nucleus ambiguous? Well, they're both in the MO. They're both quite large, but this one's larger. The nucleus solitarius is involved with quite a few nerves. So it's involved with gustation, and that's 7th and 9th nerve. It's involved in the respiratory regulation. Remember, we've got the respiratory centres. And then we've got the laryngopharynx sensation. We cover the respiratory regulation centres more in the respiratory modules. So we've got all of those. The nucleus ambiguous is the motor nucleus of 9 and 10. Yep, so just to recap here, let's just go through the blood supply one more time, because it's a very important question that you'll get asked a lot. So, we've got our midbrain, we've got our pons, and we've got our upper medulla and our lower medulla. Well, in our midbrain, we'll have our SCA posteriorly, and we'll have our PCA anteriorly and laterally. In our pons, it will just be the basilar, giving off the pontine, and also probably some anterior inferior cerebellar artery variably. In the upper medulla, it's going to be posterior inferior cerebellar artery, anterior spinal artery, and vertebral artery, and then posterior spinal, anterior spinal, vertebral. That'll do, I think. All done.